A comprehensive hearing test is a painless, non-invasive, quick, and inexpensive exam that typically takes 30 to 45 minutes for most adults, depending upon the required tests. Upon completion of the hearing test, the hearing professional will be able to tell you if you do have hearing loss and if you are a hearing aid candidate. The hearing test begins by your hearing professional taking a thorough case history, which may include questions covering topics such as history of noise exposure, family history of hearing loss, history of ear or hearing problems, and current hearing loss symptoms you are experiencing. Next, the hearing professional will examine your ear canals and eardrum with a specialized ear light called an otoscope. This is necessary to check for issues such as wax in your ear canal or infection of the middle ear.
Now we're going to go into the test booth.
Finally, it is time to begin the hearing test. You will be placed in a sound-treated test booth or a quiet room. During the hearing test, a series of tones of different frequencies, also known as pitches, as well as speech signals, will be presented to each ear separately through earphones. You will respond to test signals either by a hand raise, pushing a button, or in the case of speech signals, repeating what was heard. Stairway,
stairway,
cowboy,
cowboy.
The lowest levels of the test signals you can hear at least half of the time are called your hearing thresholds. Thresholds are plotted for each frequency and each ear on a chart called an audiogram. Further tests may be conducted during the test. Your ability to understand words or sentences at different levels may be assessed.
Airplane.
Tympanometry or testing of the middle ear function may also be assessed. Following the test, your hearing professional will discuss with you the results of the hearing test by reviewing the audiogram in detail with you.
So this is the hearing test results. We plot
your type and degree of hearing loss will be explained, as well as difficulties your hearing loss may be causing. Treatment options and recommendations will also be discussed to determine the next step in your hearing healthcare plan. If you suspect you have hearing loss, the first step towards diagnosis and treatment of hearing loss is to have your hearing tested. Early diagnosis and prompt treatment are important with hearing loss and will result in the most successful outcome. Call a hearing professional today to take that first step.